can one tell when they are most fertile? Women can look at the different parameters, such as they can use ovulation calculators, they can do the charting of the physiological symptoms, they can use the ovulation predictor kits, and finally they can arrange for follicle tracking through a fertility specialist to know when they are most fertile. So ovulation calculators, they just give you an idea of the fertile window when you're most likely to ovulate. They calculate 12 days backwards from your expected menstrual period, add another 4 days, so those 4 days are the ones when you're most fertile. You can also chart the physiological symptoms such as rise in basal body temperature, which happens following an ovulation, or the change in cervical secretions. Rise in basal body temperature is relatively non-specific because by the time the ovulation has already occurred, so the fertile window has probably passed. You can use ovulation predictor kits. There are many ovulation predictor kits, or OPKs, that are available over the counter, and these OPKs measure the rise in the luteinizing hormone, or LH, in the urine, which happens almost 36 hours before the ovulation. So measuring this gives you more objective information, which is slightly more sensitive compared to an ovulation calculator when you want to understand when you're most fertile. If you have concerns about your ovulatory pattern or luteal phase, then you can see a fertility specialist and you can go for full follicular tracking. Follicular tracking involves doing serial ultrasound scans and blood tests to check the development of the follicle and the rising the estrogen levels as the cycle progresses. And then it is confirmed by the rupture of the follicle and measuring of the progesterone levels that gives a full information as to how the changes happen in your cycle and when you might be most fertile. So these are some of the ways with which you can know when you are most fertile.